2 years ago, we began this journey of COVID-19. We've been walking this new path and this new change in our lifestyle with words like social distancing, masking, hand washing, talking about virtual learning, remote learning. We've been dealing with isolation, quarantines, testing, vaccines, infusions. We've been welcomed to a brand new way of life. Now we are dealing with a new variant, Omicron. What do we know about Omicron? Well, Omicron appears to be very contagious, more contagious than any other variant we've dealt with. However, the encouraging news, it appears to be a little less more virulent. It means that it doesn't make us as sick. That is good news. I spoke with Dr. Gary Goodnight at the health department, partners in dealing with this. And he said presently 90% of new cases being detected are going to be of the Omicron variant. So how has Omicron affected our community? Well, the main focus will be the hospital. We still continue to run at capacity at this point. Our ICU is full, our ER is full. We continue to decline transfers from outside regions because we do not have the beds that are needed. It makes our staffing very difficult right now. There's a shortage of nursing staff. There's a shortage of employees at our facilities right now. At this time, we have close to 100 of our employees quarantined secondary to Omicron. So what can we do as we deal with this new variant in our community? Well, there's several things. The first thing, and the best thing, is vaccinations. The Pfizer vaccine, when you have given both doses plus the booster, can decrease hospitalizations as much as 85%. If you've only had 2 of the vaccines, then it's going to be around 65%. The vaccine can be given as young as 5 years of age. The infusion clinic has proven to be very effective in treating the early symptoms of COVID-19, particularly of the Delta variant. However, the monoclonal antibodies we have now, the Regeneron and the BAM, are ineffective against the Omicron variant and actually can make the symptoms worse. There is a new monoclonal antibody on the horizon by the name of sotrovimab. That medication is very effective and decreases hospitalizations by 85%. Unfortunately, it is in very short supply. Texas has only received 2,400 doses, and as of today, Abilene has been unable to obtain any doses, and we are waiting on the state. As soon as we have the opportunity to get that medication, that new monoclonal antibody, we will begin the infusion clinic with that medication. Another treatment plan is some new antiviral medications. One, Paxlovid by Pfizer, has been shown to decrease hospitalizations by as much as 85%. If given in the first 3 to 5 days, the symptoms can be very effective, and that is something you should talk with your primary care physician about. We still hold that treatments with isolation, with quarantining, with masking, with social distancing are still essential to the treatment and prevention of COVID-19. Another important aspect in the treatment and prevention of COVID-19 is going to be testing. And testing in our community has been readily available. Fortunately, you can pick up these tests and do home testing through any of our local pharmacies, also at our Hickory Place. I'd like to thank our community and the partnership we share with our health department, with Dr. Gary Goodnight, with our city council, and with our community. Because of you, we are able to say that not only are we surviving, but we are thriving. Thank you very much.